Good afternoon. Thank you very much for giving us this opportunity to come here, be part of this event and to present. My name is Arvind Balakrishnan. I am co-founder and CEO of bEarly Technovations. We are a health tech company which is essentially into gait analysis. I'll just cover it in a bit more detail as we go along. So, as we know, India has a large population and it's aging very rapidly. So this has led to a situation where diseases which tend to occur in old age, for example, Parkinson's disease, Alzheimer's, stroke, dementia, the number of patients who are suffering from these diseases is increasing exponentially. There are about 40-50 million people already in India who are actually suffering from these diseases, and this is expected to kind of double in the next 20 years. The challenge obviously is that today a lot of these cases go undiagnosed, because in many cases the symptoms may be slight, and only once the disease has progressed, only then the intervention is made. So this is the problem we are trying to address. It's a large problem, it's a growing problem, very relevant for our country. So let me explain our product. So essentially we make what can be termed as a wearable. So this consists of a footwear which has integrated pressure sensors, and this is linked to a gyroscope, an accelerometer and a Wi-Fi antenna. So what happens is, if there is a person, an elderly person who is suspected of having, say, Parkinson's disease, the doctor will ask that person to wear the device and walk on any level platform for about 3 to 4 minutes. The device actually measures the person's gait, i.e. how he moves his legs and feet at the time of walking. Various parameters are measured. This is transmitted to our platform. So we built a proprietary platform that takes in this data, analyzes it, and provides essentially a set of inputs to the doctor or the physiotherapist who is evaluating the patient. Bases the numbers and the inputs, the doctor can make a very early stage diagnosis of all these conditions, including Parkinson's, Alzheimer's, dementia, even stroke for that matter. So it's a solution which is in two parts. There's a hardware element and a software element. This is a B2B product. I just wanted to mention that. So we actually market this to hospitals, diagnostic centers, old age homes, elderly care centers, clinics, and independent neurologists and physiotherapists. This is not intended for the patient to take home. The test is typically done in a clinical setup. So I just want to spend a minute on our model. So of course, as the doctors conduct more and more tests on our platform, we are building up a database of analysis data, gait analysis data, on which we will run AI models that will enable us to more accurately capture gait information specific to Indian population. Specifically, it will help us to provide more and more sharper inputs to the doctors and the physiotherapists on how to treat this patient. Now, we are not aiming to replace the neurologist or the physiotherapist. That is not our aim. Our aim is to ensure that the analysis becomes sharper and quicker. Let me share an insight with you. Today, the other day I was at NIMHANS, which is the premier neurology institute in the country. If you see the crowd over there, elderly patients from all over the country, the doctors many times hardly get few minutes per patient. It is not possible for the doctor to accurately gauge the patient. Even in private hospitals, we have, if you see Apollo, Gleneagles, Fortis, all these hospitals, how these diseases are diagnosed. Patient comes, he verbally explains the symptoms. When I walk, I feel dizzy. When I walk, I feel I'm going to fall down. When I stand up, I need some support. So basis the patient's verbal feedback, then the doctor will say, please walk and show me. And the patient will walk up and down in the corridor or inside the doctor's room. Only basis of visual observation, the doctor will aim to diagnose this disease. Of course, the doctor will have experience, the doctor would have diagnosed cases before. But neither it is quantified, nor it is structured, nor it is quick. And definitely it is not consistent. One doctor may look at a patient's gait and give diagnosis X, another doctor will give diagnosis Y. That is the situation currently. We are aiming to structure and standardize this through this product. Now, as the AI model runs on the data, the inputs that come out of the model will be sharper and more fine-tuned to Indian population. This in turn, of course, increases the value of the diagnosis, which in turn we expect will increase the adoption. So this sets in motion this flywheel or a virtuous cycle where we believe that once we cross about 3,000 tests on the platform, the adoption of this product, the attractiveness of the solution will increase dramatically. And that will be our tipping point. So we are aiming to reach there as soon as possible. So as I mentioned, it's a B2B product, so I'll just spend a minute on the pricing. So we have three models. The hospital, the clinic, or the neurologist can go for an upfront purchase, wherein we provide 3 pairs of footwear and few accessories as a kit. This sells at 75,000 rupees to the hospital. Plus, we also charge 120 rupees per analysis which is conducted on our platform. This is billed post-paid on monthly basis to the organization. We also have a rental model, 20,000 per year, which is payable for 4 years. We are also now experimenting with a pure paper test model, where the device is given to the hospital. It remains company property, it's just deployed in the premises of the hospital. And then we charge on a pure per usage basis. So we are aiming to cover a very wide segment of customers, right from very large hospitals, right up to smaller hospitals, care centers, until small clinics and independent neurologists, which is the solution. Yes, I also must mention the manufacturing cost of the kit, which is the hardware that we provide to the hospital, is 18,500 rupees. So even on the rental model, we actually recover the cost of the kit in the first installment of the rent itself. We have great margins on the hardware. And on the SaaS, the cost is negligible because the product is already developed. So we have good margins on this service. So this is our traction still now, quite early stage. My co-founder, he spent a couple of years developing the product. He was a student, he was an engineering student, young man, he developed the product. We've aggressively taken it to market from sometime around October, November of last year. We are deployed in 15 locations, primarily Chennai, Bangalore, Coimbatore, and you can see some of the logos: Apollo Hospital, Rockford Neuro Center, Gleneagles, KG, Brains, SIMS Chennai, Kaveri Hospital. These are some of the reputed hospitals which are using our product. 7 of them are paying customers. They've purchased the product. Rest of them are trialing it. Sorry, 8 of them are paying customers. Rest of them are trialing it. We are also in discussion with Apollo Hospitals for a PO, which is in process. We haven't got it yet. This will be a pan-India procurement for 12 of their hospitals. We are also running a benchmarking study with NIMHANS in Bangalore. So our product is deployed in NIMHANS and they are actually using it on their patients. And also benchmarking it against some of the other, the current way of diagnosing the conditions. So currently we've already raised about 70 lakhs in funding. This is in 3 parts. There is a 10 lakh grant which we received from Government of Tamil Nadu, entrepreneurship support. There is 50 lakhs we've raised from Startup India Seed Fund. And we've also raised 10 lakhs very recently from a US-based angel investor. We are looking to raise another 2 crore. And this will predominantly go into product and tech. I'll speak a little about our future product roadmap as well. So this will go into product and tech. Some part into hiring a sales team, and some part of it also to build some inventory and for working capital. That's predominantly how we are going to use it. The plan is in 3 years, we can do a cumulative revenue of about 7 crore. This is based on the current model, what I showed you. This is just neurology B2B. And we can do 700 customers and about 7 crore in revenue. And we do aim to be profitable right from year 1 this year. Now, I'll just speak briefly about our company as it exists today. So we are super small right now. It's just me, my co-founder, and 2 others. We do all of the product development and the selling by ourselves. Post this round, we aim to hire a small sales team, maybe 1 or 2 people. Plus also maybe 1 more tech person. That's on the hiring side of it. We also want to build the product further. Now today we cater only to neurology and we only have a B2B product in place. But even with the current hardware that I showed you, there are other possibilities. For example, with the same sensor integrated footwear, we can also enhance the software side and start catering to diabetology use cases. For example, which affect the foot. There are use cases in orthopedics, where accident victims, for example, are trying to regain their walking. Then, of course, we can, in the long term, we can also explore a B2C model. There are a lot of elderly patients who require continuous monitoring of their gait, who are at risk of falls. A lot of elderly patients these days live alone. So they also need continuous monitoring. So that is also something we are looking at very closely for our future development. I also would like to mention we are registered with CDSCO, which is the government regulator for medical devices. We are certified as a non-invasive, non-sterile device, which means we can fully commercialize. And we are also in process of getting what we call a Class A license to market this product and also to potentially cater to the government. So that's what I wanted to cover. I'm happy to take any questions. Or if there's anything else you would like me to cover, happy to cover that.
So what exactly do you diagnose? I mean, what is the output which comes after using this particular software?
Sure. So the entire analysis takes about 3 minutes to do. There is a report that is generated, which the doctor can download on his laptop through our SaaS app. This will typically have about 16, 17 parameters. For example, some of the parameters will be the length of the stride. Then it will measure the time taken for each step. And it will measure left foot and right foot separately. It will measure the time in which the left leg is in the air, right leg is in the air. It will measure the pressure, how much pressure is putting when the foot lands, which part of the foot is putting pressure. It will also measure, for example, when he moves the leg in the air, does he move it in a straight line or does he kind of take a roundabout leg? There are about 16, 17 parameters that we measure. I have a sample report, I could show it to you. All these parameters are what doctors look for when they diagnose. Yes, I also must mention.
When you say diagnose, so once they look at the report, then what do they figure? I mean, they already know that this person is suffering from Alzheimer's. They already know that the person is suffering from Alzheimer's, right? So what? I mean, I'm not able to understand what value add this is adding to a doctor's life.
Yeah.
Especially an experienced doctor who already has been seeing these patients, who already would know, right, the severity of the...
Yeah, so in most cases, this test is done on patients not already diagnosed. So this is used by the doctor or the physiotherapist or the doctor's attendant to diagnose actually. And secondly, even if the patient is already diagnosed, they tend to be in long-term care. So the doctor will typically tell them, you need to see a doctor every 3 months, and typically that goes on for the rest of the natural life of the patient. So in many cases, this is also used to tweak the treatment protocol. Let me give you an example. Like in physiotherapy, for example, early cases are treated with medication. It's a degenerative disease, we know that. There is no cure. The aim of the medicine is to maintain the quality of life or manage the deterioration at some acceptable level. But what we practically see is even the doctor cannot really predict how the patient will react to a particular course of medication. So it is a little bit trial and error only. Secondly, even if the patient will take a course of medicine and come back, the patient will claim that, please stop the medication, I am perfectly alright. But the doctor may not feel that. And the patients tend to be a bit stubborn, man. They don't take the doctor's advice face value these days. And the reverse also happens. Many times the doctor will say, I can see your gait is affected. Please increase the medication. Or I will give you a stronger dose, different combination. Patient doesn't agree. Even if the patient agrees, patient's family may not agree. So this provides a very objective kind of a report. And the doctor can very clearly see for the same patient, same set of measurements, 3 months back, what was the status, now what is the status. And this is very clearly used to have a discussion with the patient to tweak the medication. Not only medication, even physiotherapy protocols.
So what I'm thinking is gait the only thing which the doctor sees before they take a call on the medication? There must be other symptoms. I mean, it has to be a more holistic view of the patient before you change the medication or the dosage or whatever.
Actually, for the diseases that I mentioned, today gait analysis is 95%, they go by the gait analysis only. There are other parameters like slurring of speech, memory, but these are highly subjective. Highly subjective. Doctor will not be able to make out in his clinic. So today they go by gait analysis. But today it is completely subjective, depends on the doctor's view. We are trying to objectify it and may bring some method to it.
Sure, understood. Thank you.
Thank you for the presentation.
Thank you.
I wanted to understand when it comes to the product, has this been developed in-house or is it white label? The product, is that developed by your team or is that currently being white labeled?
No, it's not being white labeled. Okay. My co-founder is a young man, engineering graduate, very passionate about product. He has developed this project. He has completely developed this product from scratch, including design, including the sensors, the calibration of the sensor, everything he has done in-house. This basically took up 3rd year and 4th year of his engineering.
So where is it manufactured right now?
So we manufacture it in a facility in Chennai. We source parts from multiple vendors and the final assembly is done in Chennai. So this is like fairly off-the-market parts. Footwear comes from Coimbatore. One sensor we used to buy from Taiwan, we've just moved to a vendor in Mumbai. Accelerometer, gyroscopes we procure locally in Chennai. It's completely assembled in-house by us, by me and my co-founder.
And is the device rechargeable or it has a fixed life?
Yes. It has a battery. It is rechargeable using a normal Type-C charger.
But even with charging, how many uses can it?
Thank you for asking that. Yeah. So it takes about 2 hours to charge, and once it is charged, it can be used for up to 2 hours of testing, which means each test will typically take about 3-4 minutes. So you can conduct easily about 25 tests, 25 to 30 tests. In a practical scenario, the hospital will need to charge it once a week.
So in the image that you presented, there were these like sandals on which the white device was attached, right?
Yes.
So does it go with that piece of footwear and the white device, or is it just the white device?
No. We provide the footwear as well.
So then how do you account for different foot sizes?
Yeah, thank you for that. So our kit, which I mentioned, which we sell to the hospital, so that will have 3 pairs of footwear. We provide a size 5, a size 7 and a size 9, which will cover 90% of cases. We also have a size 11 in case the hospital needs it. So the footwear, by the way, is an integral part of the product. The footwear actually has pressure sensors embedded inside the insole of the footwear. The white device is only the gyroscope, the accelerometer and the Wi-Fi antenna.
So say if someone is a size 6, so they're in between, wearing a shoe that's too large or too small, will that automatically impact the gait?
Yeah, we've actually tested this. What we find is one size here and there doesn't really make a difference. So hence we give 5, 7, 9.
And with regards to the platform, the AI analytics layer of that, is that developed in-house or do we have a partnership for that?
Completely in-house. Completely in-house. So my co-founder is the complete tech brains behind it. So he's developed it.
Because we've looked at a couple of these models in the past, primarily in the cardiovascular space, and whenever you see the device piece of it, that gets outdated very quickly with the rate of innovation that's taking place. But what survives is the platform. As long as it's device agnostic, it tends to work across different, as long as it's embedded into the hospital's back-end systems, that continues to deliver good revenue. So what's the thought with the device and the platform? That is the device the entry point and then you're going to phase that out and focus primarily on platform? Or is the focus going to be more on device and less on platform?
No, the focus will be on the platform. See, because to be frank, the real value for us is in the data and the output that comes from running the models on them. See, for us, a device is a way to get the data into our platform quickly. So that's the way we are looking at it. This is not going to be the only device, right? So in future, we may have other devices as well. And even on the platform, today it may be tuned only to work for neurology cases. But like I said, we are already working on diabetology and orthopedics. We can have other use cases as well. The real value is in growing our data and to build a pool of gait parameters in this case, which are from the Indian population. And then there are opportunities to kind of monetize that. That's what we're looking at.
Okay, and final question on with regards to the commercialization, you said it's like 120 rupees per report and then the hospital is charged a certain amount, right?
Yes.
Now, the way the healthcare delivery system is working and increasing focus on RPOPs, how are the hospitals getting on board with bearing that cost, or are they applying their own margin on these reports and charging it to the clients? To the patients?
No, if I understood your question, you are asking how does the hospital charge the patient?
Pass on the cost to the patient?
Oh, yeah.
Or do they? Because we see increasing resistance from hospitals to charge customers for additional items because people don't want to pay more and more. We continue to be a price-sensitive market, and they also want to increase their margins and their RPOPs. So how are you going to get that piece sorted out?
So see, that's actually been some learning for us. That's actually been a learning for us. We are still learning, okay? But what we have seen is that the patient is not really cost conscious, okay? And we've sold this in places like Trichy and all, where people don't have lakhs of money to throw around, frankly. There is no resistance to payment. The resistance comes when the patient doesn't see anything tangible coming out. Okay, so let me take your other question. So we have hospitals who charge 300 rupees to the patient. We have one hospital that charges 1000 rupees for the patient also for this test. They give us 120, rest is their margin. patients pay because what they see is that after undergoing 3 months of intense physiotherapy or medication for Parkinson's, they are able to get something tangible in terms of a report that clearly says, hey, these are the 10 places where you improved, these are the 5 places you need to improve. So they gain that confidence. That's what we've seen. And in many cases, there are exceptions. For example, if the doctor is very senior and very reputed, the patient will take the doctor's advice on face value, frankly, right? We all respect doctors. But in many cases, there are patients who don't. There are patients who will question the doctor back. There are patients who will skip physiotherapy sessions simply because he says, I'm not convinced. I'm improving. I don't need this. So this kind of, and ultimately it comes back to the doctor. Ultimately you will blame the doctor only. You will say, you told me I'm not improving. So this tends to settle those cases. But we are still learning. We are still learning, frankly. It's 6-7 months into the GTM journey.
Just take a couple of suggestions. No questions. Is it possible to actually instead of the footwear, can you actually do something like a mat? Okay, that's one thing you can think through, so that you don't get into all the size and all those things, right? And also, accept the pressure. Most of the other things, when like how the person is moving his leg and all those things, can be done using vision. Just think about that.
Sir, you want to answer? I'll just add a couple of points. Sir, very valid feedback. Very valid feedback. Thank you for that. The main challenge in using a mat is that the mat will only know where the foot is being placed and the pressure placed on the foot. But a lot of the parameters we provide, and this is how we differentiate from our main competitor. I'll just take a minute on that as well. We provide the parameters based on the aerial movement of the foot. Even when he lifts the foot, how the foot is moving, etc., which a mat cannot measure. Incidentally, the so-called gold standard for gait measurement is a mat device. It's called Gait, right? It's an American product. It's imported into India. There are only maybe 55 hospitals in India where that product is deployed. And the cost of that product is 70 lakhs. 70. So, I mean, and doctors are clearly telling us, yes, we have the product, but hey, it has all these limitations. We don't really use it. That's what I wanted to say. But thanks for your feedback. Very, very valid. Happy to take any other questions. Okay. Thank you very much. Once again, thank you for this opportunity. Thank you.